Samantha. How are you feeling? You okay? Okay. It's good to see you out of ICU. Yeah. So I think with her case, we probably just need to be aware that she's been in hospital for quite some time. She's been in ICU. We're probably dealing with more hospital-acquired type infection. I think her risk factors are significant, and we'll have to ensure that we send off adequate samples and specimens.
So when do you think you'll be able to see your family again?
I really don't know. I don't know.
The hospital that we work in would have about a third of the patients on antibiotics. These drugs are life-saving. Antibiotics are essentially the therapies that we use that can combat bacterial growth, and that's essentially why we need them to treat infections.
Morning.
Hi. Morning, Mrs. Abrams. How are you feeling? You a bit better? That's great, that's great. So AMR is antimicrobial resistance. It's really antibiotics that are no longer effective to treat infections. AMR is globally on the rise, and it's a threat to our survival, essentially.
So healthcare facilities face two challenges. You have patients that arrive with multi-drug resistant organisms because they've been admitted to another hospital, or they've come in with resistant organisms that they've acquired from the community. When a patient is resistant to antibiotics, you cannot predict the outcome, and that's a scary place to be in.
And we'll get some tests off to see whether we need to change your antibiotic treatment, okay? Okay.
The two most important things that the general public should know about antibiotics is number one, that they make life as we know it possible, and number two, they cannot be taken for granted. I think if antibiotics fail, then our loved ones fail. Antibiotic stewardship basically comes down to using these medicines wisely, understanding that sometimes we have to use more, sometimes we need to use less, and sometimes we have to use them differently. It's a little bit of a misconception that the onus or the responsibility is just on the healthcare providers. The responsibility is on all of us. So if the doctor says 7 days, you take it for 3 because your infection goes away, you may seem okay, but you could still have some cells that survived because they adapted and now they carry a resistance gene and they can come back stronger, more powerful, and may not then respond to the antibiotic. So overuse is a clear driver, but underuse and misuse of them also drives AMR. If we have a strong stewardship program in place, what we're basically doing is we're creating a protective shield around the antibiotic because we're thinking very carefully when we use them, how we use them, and for how long we use them. I think the responsibility is on all of us, and we can all do our parts to put AMR back into the corner where it belongs.
So the laboratory is where it all happens. I mean, this is where we see the specimens being processed and we get the information about what the identification is of the organism, and we also get, more importantly, what antibiotics it's resistant to or what antibiotics we're able to use to treat this infection. So we're constantly having to battle between antimicrobial resistance being an ever emerging problem and making sure that we use antibiotics appropriately to treat the infection.
So the patient's blood culture flagged positive, which is
Okay.
interesting.
Wow.
What we have here are the
Okay.
disc susceptibilities, and you can see the lawn of growth. It grows right onto the antibiotic discs, and you can
Okay.
see there are almost no zones present,
Okay.
which
okay. So those are quite resistant
Yes,
genes. I think we're going to be very limited in terms of what antibiotics we'll have to treat this infection. That's very concerning.
Yeah, overflow is quite busy.
Yeah, I'm sure. Let's see what awaits for us. Unfortunately, Camilla is particularly vulnerable to developing an infection, and without antibiotics, we wouldn't be able to treat her. And we've seen patients die as a result of an infection which occurred after they've had their successful surgery, and that is due to resistant bacterial infections.
It's a balance between existing and new, between making sure we continue to have access to what we have now and promoting the development of new tools. We can't get rid of AMR, but we can definitely preserve the effectiveness of these antibiotics for future generations to come.
We still have time to act, but only if we treat antibiotics as a precious resource. They are a cure that we must protect.